This is the Eurus S6 Folding Leg Rest Treatment Centre, our flagship product. One of the main benefits of this chair is that the delivery system can be tucked away behind the back of the chair. This creates a non-threatening atmosphere for the patient. Many patients in the UK are dentally phobic, so when they actually see the handpiece instrumentation, that actually gives them cause for concern. I have my colleague here today, Patrick, who's going to assist me in being my patient for the day. So Patrick, if you wouldn't mind just coming in. So when Patrick's sitting as a patient, it's very important for you, the dental team, to make sure that the patient is sat right back into the base of the chair. If you allow the patient to sit forward, it actually doesn't assist and doesn't get the patient comfortable when they lie back. They end up not being supported in the lower lumbar. There is a push button adjustment on the side of the headrest that raises and lowers the headrest, and a squeeze mechanism that does the articulation forward and back. Okay, but I'll just leave that at a regular position for Patrick. So Patrick, I'm just going to actually bring the chair back down. So if you could just be aware that's going to happen, I'll just bring you back down. This chair can be set for 3 different patient types. It can be set for a standard adult, an elderly patient, or a child. As you can see here, Patrick's very comfortable, his shoulders are supported, and he's come to a naturally relaxed position with his hands. So instead of reaching to the left and the right to grab the armrest, which is what some patients do when they're nervous, they actually feel that they're well supported. Having the armrest actually is a good thing, because some older patients feel nervous that they may fall off the edge of the chair if there's no armrest. So having the armrest actually in place gives the feeling of security for some patients too. So what I'd like to also show you while Patrick's in this position is how to use the headrest for positioning of the head, particularly important if you're working with direct vision on the upper arch. The upper arch is the most difficult tooth surface for the dentist to actually get vision on. So what I'm going to actually show you here is I'm going to support the head. Very important when you're actually adjusting the headrest that you fully support the cushion. The patient's head can be quite heavy when you release the articulation. Now, important at this stage that before you even move the headrest, that you check with the patient that they are actually not suffering from any long-term neck or back problems. If they are suffering from those problems, don't pursue the tipping the head backwards. It's not a sensible thing to do. So I'm going to support Patrick's head, just move the bar in slightly. What I'm going to do is move the bar in and tip Patrick's head back by squeezing the mechanism. So I tip the head back here, and what I've done there is I've changed Patrick's articulation. So now the upper thorax is extended, and I can actually see directly into the upper arch. Now, you're never going to remove tilt from dentistry. There's always going to be an element of tilt. But what you have to try and prevent is this movement here, which is a problem for long-term back injuries and neck injuries from dentists actually getting themselves into contorted positions. And it's particularly noticeable when a dentist is treating a patient, and sometimes a dentist compromises and says to the patient, let's say, I won't bring the chair all the way back. Now, of course, if you're not bringing the chair all the way back, then you find that you have to bring the backrest up, lower the chair, and it actually still makes it very difficult to see the upper arch. So you're having to twist your shoulder, you drop your shoulder down, and that's causing quite a lot of pressure onto the lower spine. So there, if you can actually get the patient into supine, it does help with vision as well. So thanks, Patrick. What I'm going to do is I'm going to bring the chair back up, and then what we're going to do is I'm going to show you the discussion position. So one of the great features of this chair is that once we get the patient back into exit position, a lot of dental systems, you have to, the patient has to leave the room before the nurse can actually do any clean down of the instrumentation. But with this system, because it goes around the back of the chair, it's out of sight of the patient, so the instrumentation that may have various items from the treatment that just happened on the tray has now gone round for clean down, and I'm sitting here with Patrick and I can offer this sort of consultative position. And for a patient, one of the nicest things that I've been told by customers who have bought this is their patients feel like they're human almost. Their feet are on the ground. They don't feel like they're in a dental world. So I can chat to Patrick here and say, look, next time you come, we're going to have a look at that crown again and see if there's something we can do about it. But I'm person to person. There's a really nice feeling of sort of contact here. So it makes it comfortable. And in the modern dental surgeries that are designed with the big television screens so the patient can view, you can almost use it as a consultative tool. You can be pointing to an image of an x-ray or to a picture that you may have taken with your intraoral camera and say, this is what we're going to do next time. It's up here and this is what we're going to look for. So very, very important. But while Patrick's there, we might as well ask him just to remain there for a sec, because I want to show a couple of other things. The first thing, and Patrick isn't one of these patients, but you can get a patient that can be slightly wide in the seat section, that's a polite way to put that, and having the armrest drop down actually does give you quite a bit of flexibility. You're not boxing the patient in, they don't feel like they're stuck between the two armrests, so it can be less threatening. So I'll bring that armrest back. Also, while Patrick's there, we can also show you the spittoon bowl, how that rotates really closely to the patient. So if Patrick did have any back problems or neck problems, that could get closer to him for rinsing. Also, the spittoon housing can be moved out of the way this way, and I can actually come from both sides of the dental chair. Maybe if I was doing a surgical, I could come from this side and have good access into Patrick from both sides of the chair. And also the bowl, while I was doing this, if there was a need to rinse, Patrick is very close to that as well. So the bowl can still move even though the spittoon housing has moved out of the way. I'll bring that back in. While I'm doing that, I'll also take the bowl off, if my patient will forgive me for taking the bowl off. But this just shows that the nurse can take the bowl away and get it cleaned. And so that can come, always make sure that's on a solid surface when you're placing it, so it's not on a stool that can roll off. It's porcelain after all. And then you see here we have the bottom of the spittoon bowl. Below there, you can easily get in there to clean that out and adjust that way. And now what I'm going to do is put the bowl back in. So I take the porcelain bowl, and it's quite important to remember that we actually force that in nice and firmly and twist it in so it's nice and locked in place. Very important to remember that, because sometimes some patients hold on to the spittoon bowl while they're rinsing. If that's not pushed in firmly, they may well, knock the spittoon bowl off. So one of the things that we're trying to do here is we're trying to show that we can get a wheelchair patient close to the seat section so it's easier for them to slide across. There can be nothing more distressing for a wheelchair patient than being lifted by the dental team out of a wheelchair. So anything you can do to make that process easier is going to be worthwhile. So as you can see from Patrick's position. Now also I want Patrick to just jump out the stool for a second for me there. I'm going to bring this around to the back of the chair, and I'm going to show you something that can also be done if you have enough space within the surgery. We're going to ask Patrick to sit here. See if you don't mind Patrick sitting there. We're then going to take the headrest, we're going to articulate it backwards here, so we're going to turn the headrest cushion backwards, and then going to ask Patrick, we'll manoeuvre Patrick into position as a patient. Now, I'm not saying that you can do a crown prep or anything, a substantially long dental treatment this way, but there's absolutely no reason why a dentist can't do a checkup, or a hygienist can't do a checkup or a scale and polish from this position, or an x-ray even. Whatever you can do to minimise stress for the wheelchair patient has got to be a benefit. So here, and if the patient is bigger than Patrick, let's say is a big, really tall guy, if you just lift your head forward there, Patrick, for a sec, we can just raise the chair to meet the back of the head of the person. But in the meantime, if you rest back there, you see, this is possible, but only possible if you have enough space behind the back of the chair. So obviously if your surgery is designed with a little bit of space behind, this actually makes it very easy. The next thing I want to talk about is the operating light, the 900 series LED light, which is sensor controlled here. If you have a chair mount light with your S6 package, you'll be able to control it from the nurse's workstation and also from the intuitive touchscreen as well. But this particular version is a ceiling mount, so it's just controlled from the sensor here. It's 10 LEDs at 39,000 lux. And one of the unique features about this dental light is that it has an intensity adjustment on the back. So rather than us decide what should be the right light for your surgery, we actually put an adjustment here for you. Some companies actually put fixed percentages of light, but we think that that choice is down to you. So you can adjust the light there. The bright green will show you where the intensity adjustment is. Also, sometimes when you're doing a treatment, you may want to work on a material that is the unique cure safe mode. So basically, if you hold your hand under the sensor, it steps down to 4,500 lux. So basically the light is now a much lower level and will be a lot less likely to set the material that you're working on in front of you. To switch it off, again, just turn one swipe underneath. Unique feature also, if I just put the light beam onto the chair here itself, most Belmont lights should kind of be used at one arm's length away. So if I just put there for you, you can just see as we come in closer, the light pattern is more even and less shadowing on there. So one of the big problems that dentists face sometimes is that the nurse is unable to see what's going on. So they tend to lean in. I don't blame them for this. They have to try and see what they're doing. And sometimes I kind of wish the dentist would allow the nurse to take their position first, and that would make it easier for the nurse to actually to find the right place to put the suction tip. But here, now imagine the nurse's head has come into the way of the light pattern. You see, even with massive interruption into the light, the light manages to maintain a really good level. So even with the nurse leaning in, there's a fair chance that that won't actually affect the light too much. I think that's a nice feature that there is. Obviously it's LED, so less heat, and no bulb changing, which for a lot of nurses out there will be a great relief. We obviously have the nurse's workstation here, and this features a safety feature that you need to know about. If this particular manifold gets lowered onto a stool or onto a worktop or onto, God forbid, a nurse's leg, once it hits the blockage there, it actually turns the safety here onto red. So that stops the chair moving. So it's a safety feature. So blue light, we're obviously in a go situation. The moment that safety switch is activated, the red light comes on there. You'll see here that we have suction instrumentation, and this suction tip can rotate to a straight position, or it can be put round to a 45-degree angle. Now, what the 45-degree angle enables the nurse to do is take their position without putting any pressure on the hose and twisting the hose. One of the biggest areas of product damage in a dental surgery is suction hoses. They're constantly splitting and being twisted and having to be replaced. So what these straight tips do is, if you imagine that this was the old way of doing things, the nurse, when they were suctioning, used to bend the hose over completely like this, and that's where the stress comes on the tubing there. And once cleaning materials have been added and suction cleaners have been added, it makes it a sort of a volatile or weak spot. So what we have here is changing that angle. It takes the complete pressure off the hose. There's no squeezing and bending of the hose, so hopefully they should all last longer. Now, the holders themselves, they can actually be taken out for cleaning as well. So if you notice here, there's a little clip on the back there, and then you can get in and give them the good wash down. They are autoclavable as well. There's a drop-down door on the front of the spittoon that opens here, And here is our filters that the nurse needs to check on a daily basis. So basically this filter here pulls out, and if you notice from the filter, it has a locator on the top there and a notch that's taken from outside at the top of the circle here. So that locator sits into that notch. If you put this particular filter in incorrectly and put it in the wrong way, basically the center of the filter there can block the suction, so you must make sure it's always in the right location. And if you do have any silicone lube in the practice, it's not a bad idea to just put a small dob of silicone lube on this O-ring, keeping that O-ring nice and free for when you push and pull. So push and pull is the key here. Instead of pushing, when you put the filter in, you don't twist it like the old filters used to be twisted to tighten in. You don't need to do that here. You basically just pull and push straight in, like that. Very straightforward. If you ever get a damaged hose or it's time to replace the hose, these hoses are on quick disconnects here. So you can quickly just pull them off and put the new replacement one back on. One item I do want to show you on this side of the chair that we haven't shown you, but it's actually quite important that you know is there is a green light on-off switch on the base of this chair. So just down here, there's an on-off switch, and if it's illuminated, it's on. If it's not illuminated, it's off. Also, another safety feature is the lid of the floor box on the side here. That is on what they call a safety switch. So if you put something underneath the base of the chair and then you lowered the chair down, the floor box, the lid would rock, and that would set off a stop, an automatic stop. So that's a safety feature as well. That was just a quick rundown of the Eurus S6 treatment centre. As you can see, there are some major benefits for both yourself and for your patients.